Hello, Alicia.
Hello,
Thank you
Tim.
for hello. Thank you for inviting me to do this. I'm really looking forward to this. So, my name's Dr. Timothy Barrett. I'm a children's doctor, and I work at Birmingham Children's Hospital. And I'm a researcher, and I do research at the University of Birmingham. At the moment, I still do some Alström clinics for children. But the main lead at Birmingham Children's Hospital is now my colleague, Dr. Melanie Kershaw, who's a very nice doctor. And then she's also supported by Dr. Nicolina Cipriano, who at the moment is off because she's just had a baby, but we hope she'll be coming back in the new year. So I still do some clinics and I also do some research.
Hi, my name's Alisha. I'm 19 and I have a brother with Alström. And I help with Alström Syndrome, making lots of videos. I take part in a lot of things with Alström Syndrome. Tim, can you explain what Alström Syndrome is? Because a lot of people out there do not know about it.
Yes, of course I can, Alicia. So Alström, it's the name we use for a group of symptoms like vision problems, hearing problems, heart problems that seem to happen together more than you would expect by chance. So lots of people have vision problems. Other people might have a hearing problem and others might have a heart problem, but very few people have vision and hearing and heart problems together. When they all occur together, we call that Alström syndrome.
Why is Alström a rare condition and how many rare conditions are there?
Well, we call a condition rare if it affects less than 1 in every 2,000 people. And we think Alström is rare because it affects only about 1 in a million people. So that makes it very rare. And we think there are about 8,000 different rare conditions, and Alström is just one of those 8,000 conditions.
How many children and young people are there with Alström Syndrome UK?
So we think there are between about 25 and 40 children and young people with Alström in the UK, and they live all over the country, all the way down south in Cornwall up to Scotland, anywhere in the country.
Can you explain what research means? Because a lot of people out there do not know what it means.
Yeah, research is quite complicated, really. If we do research, we mean we're trying to find out some new facts about something. So if I do research into Alström, it means I want to find out something new about Alström. It could be a new part of the condition, or a new gene that causes Alström, or a new treatment for Alström. Any of those can be called research.
Are you working on any specific Alström research?
Well, there's lots of research taking place at the moment. Professor Rick Steeds, so he's the heart doctor at the Queen Elizabeth Hospital. So he's doing research to find out new things about the heart in Alström. Professor Tarek Highwatt, so he's the lead for the adult clinic. He's doing research on growth and development and the liver with Dr. Melanie Kershaw and myself. And there's a doctor in the University of Birmingham who I found out today who is doing research on diabetes in Alström. Then there are people in France trying to understand how the gene for Alström works in the body. So there's lots of people in Birmingham, in the UK, and around the world who are trying to do research to find out new facts about Alström?
I've never been part of a clinical trial.
Okay, so I can try and explain what a clinical trial is and how it could help people with Alström. So a clinical trial means doing a fair test. So an example is, let's say we have a new medicine that we think might help people with Alström. In a clinical trial, we find people with Alström who would like to take part in the test. Then we give half of them the new medicine, and the other half we give a dummy medicine. Now, a dummy medicine is one that doesn't work. It's completely safe, but it doesn't work. Then we see everybody every few weeks to do tests and see how the medicine is working. At the end of the trial, we see if the new medicine has helped people with Alström more than the dummy medicine. And if the new medicine has helped, then we say the new medicine works because it helps people with Alström. So does that make sense, Alicia?
Yes.
Oh, great. Fantastic.
Are there any clinical trials being taking place for Alström syndrome at the moment?
Well, I did look online, but I didn't see one at the moment. But there has been a clinical trial that Dr. Tarek Highwatt did a couple of years ago in the Queen Elizabeth Hospital. And he had some adults with Alström who took part trying a new medicine to see if it would help people with Alström. In fact, there were two different trials there. Um, medicines looked promising, but there wasn't enough evidence to be sure that they help people with Alström. So I guess now we're looking to see if we can come up with another trial that we can invite people to take part in, because with more research, we're finding better medicines that might help.
Are there any clinical trials for children and young people to take part in?
So there are lots of trials for children and young people with other conditions, but I don't know of any clinical trials for children and young people with Alström. Now, that's partly because we try and do clinical trials in adults first to check they're safe. And only once we know they're safe will we do trials in children and young people. So I think the next trial will probably be in adults with Alström. And then if we know it's safe or works, then we'll do it in children.
That's very interesting, Tin. Can you explain what repurposing medication means?
Well, these are quite hard questions, Alicia. I'll try and explain this one. So we've got lots of medicines that we use for illnesses, such as tablets for the heart, injections for diabetes, or headache tablets. Sometimes we can test a medicine for Alström that is already being used for a different condition. So repurposing means that we're reusing a medicine that's already being used for something else, and we're reusing it to see if it works in Alström. Does that sort of make sense, Alicia?
Yes.
So I suppose one example is that we could use, let's say, if you use paracetamol for headaches, everybody uses paracetamol for headaches, and then people might see whether actually paracetamol works for different sorts of pain or something else as well. Or we use insulin for diabetes, but then we see if insulin can work in Alström for the sugar issues in Alström. And I suppose the topical one is a medicine called semaglutide. It's been in the news a lot because people have used it to treat adult diabetes. and people are now using it to try and get weight loss. And what we'd like to do is to see if we can repurpose it and see if it also helps people with Alström. So that's an example of a medicine we might want to repurpose. It's used for something else, but we might want to see if it also works for Alström.
That was really easy to understand. Thank you. I got a question about cataracts. People with Alström get cataracts. Are there any treatments or can they be treated?
So you can treat cataracts by having a small operation to take the cataract out. You can do it with local anesthetic so that you don't need to be put to sleep. It usually takes a couple of hours to do the operation. And people with cataracts often go into hospital and then they leave the same day after the operation. And actually, my brother's just had a cataract operation about 4 weeks ago, and he went into hospital in the morning, had the cataract removed at lunchtime, and he was home by the afternoon. And he said it was really easy, very straightforward to do.
This is a harder question for you, Tin.
Okay.
Losing your sight can be very hard. Is there any way to bring it back or leave that sight the way it is?
Yes, that is a hard question, Alicia. Sadly, we still don't have any treatments to stop people losing their sight. There are gene therapy studies in animal models of Alström to try and restore eyesight and stop any more being lost, but they're not ready to try in people yet. And I've got colleagues I know working in London on a similar condition to Alström called Barrett beetle, where they've got promising results in their animal models, and they hope to bring those studies to patients in the next few years. And I'm hoping that if they can do that in Barrett beetle, that they might then have a go at trying that in Alström. So I'm still hopeful because people are still researching to try and find ways to keep the eyesight or prevent it being lost further.
My last question is about children's clinic. When I was in children's clinic, I did not hear much about research. Should doctors talk about it more with young people?
So that's a really good question, Alicia. I think that's a good idea. I think partly because there wasn't much research going on that children and young people could take part in. But there is more now, and we could provide a reminder to doctors in the clinic to remind them to mention research and what opportunities are available. So I think that is a really good idea. And I think the doctors just need a prompt to remember to talk about it and introduce it to young people like yourself, who are obviously going to be interested and might even want to take part. So thank you for that.
You're welcome, and it should be mentioned to people who are mature and who are before going to adults clinic.
I think you're right. And maybe we need to include that as part of our transition things. It's a job for the doctors to do as part of that handover transition.
Thank you, Tin.
Thank you, Alicia. Alicia, would you mind if I asked you some questions?
Yes.
Fantastic. I tell you what I wanted to ask. What do you think about taking part in research?
I think it's very interesting and hopeful to find some treatments for Alström syndrome in the future.
Okay, that's good. And is it something that you would be interested in taking part in?
Yes.
Oh, well, that's very good to know. That's really good to know. One of the things as a researcher we always want to know is what should we be trying to treat? So I guess I ask you, what's the most important symptom for you that you would like people to find a treatment for? So I'm thinking, is it the heart? Is it the hearing? Is it the vision? Is it the weight? What bit of Alström is the bit that's most important for you that we try and find a treatment for?
I understand you can't treat the eyesight, and obviously for hearing we have cochlear implants. So I guess it would be the weight and the diabetes.
Okay, okay, that's interesting. Okay, at the moment, I mean, obviously we'd like to find a treatment for the eyesight and try and do that, but maybe weight is something that we might be able to do something about because of the new medicines that are coming. Um, I had something else I wanted to ask you about a clinical trial, if that's okay.
Yes.
Thank you. When we talked about clinical trial, I explained that some people get given the medicine, the treatment, and some people get given the dummy medicine, and that the dummy medicine doesn't actually work. It's there just to compare the treatment against something. How would you feel if you were taking part in a clinical trial and you were allocated the dummy medicine rather than the actual treatment?
I'd be quite happy because we can find out which one is working and which one is not, and that would help the researchers find more treatments. And I think it's really important to explain beforehand what's going to happen and who, how many people are they going to be involved, and hopefully that will get more people involved in our clinical trials.
That's a really, really mature answer. And it's very gratifying to me because I always worry about having to offer people dummy medicines rather than the treatment. So thank you for that. That's a really helpful answer. Um, Alicia, thank you so much. It's been lovely talking with you.
Thank you very much, Tin, for being here and answering all my questions.